So good afternoon, everybody, and welcome to Health Professionals Communications Forum, Combating COVID-19 Misinformation. My name is Becca Bolas, and I'm Executive Director of Maine Public Health Association. Today's event is co-sponsored by U.S. Public Interest Research Group Education Fund and Maine Community Action Partnerships, with support from Partners in Health and grant funding from the Health Resources and Services Administration. And so before we get started, I just want to go over a few logistical items. Everybody is muted and the forum is being recorded. So if you do not feel comfortable being on a recorded webinar, you can hop off now and we're happy to share the recording with you. We do ask you and encourage you to focus on today's forum and interact as much as you can when we get to the breakout sessions, because we think that'll maximize your learning about what we're covering today. If you do have any questions, either about the content or about media or technical difficulties, please use the chat feature and that will be directed to me, and I'm happy to relay your questions during the Q&A after our presenters have talked. So the way that we're going to structure today's forum is that we're going to hear from two speakers who I'll introduce in a moment. We'll have a brief Q&A, and then we'll place folks into breakout sessions, and that will give you a chance to practice some of what you learned in the first part of today's session. So with that, I will introduce our first speaker, who is Matt Wellington. Matt is the Public Health Campaigns Director for US PIRG, and he will be presenting an overview of media communication techniques. And so Matt, with that, I will turn it over to you.
Awesome. Thanks, Becca. And hi, everybody. Thank you for joining us. I'm just going to share my screen here so you can take a look at my slides. So give me 1 second. Can I get a thumbs up? Does everybody see that? Okay, awesome. So like Becca said, I'm the Public Health Campaigns Director for US PIRG and the US PIRG Education Fund, and we're a nonprofit, nonpartisan consumer advocacy group. And really the role that we play in the public health community is as communicators and advocates. And so we partner with folks like you on this call who have the issue expertise, who have that background and credibility on health issues, and we help to get your messages out to the public and to decision makers in an effective way. So you should think of us as like a megaphone, basically, for public health issues. And what I'm going to talk about here is mostly based on my own experience doing media outreach for the last 8+ years. So that's not to say that I know the answer to everything about being a great media spokesperson. I'm going to share some of the tips that I have found helpful, and also the pitfalls that I've found helpful, so that you don't have to repeat my mistakes working with the media. And I think the thing I want folks to come away with, and the real goal of this overview and of our breakout group, is to get you comfortable with sticking to your message, right? Because as a health professional and a spokesperson in the media, your role is to share credible information, but also your role is to get the most effective message out to the public. So we're going to talk about that and practice it. And then, as Becca said, we are supported through a HRSA grant. So that's my quick acknowledgement on that. And then what we're going to cover here. So real quick basics on media. I actually forgot to set my timer so that I don't go over. Otherwise, I'll just ramble and ramble. So media basics, I want to just give a really quick lay of the land for the media outlets that are out there and the difference between them. We'll talk about honing your message and then tips for staying on it. Again, that is the most important thing I want you to come away with. Stay on your message. We'll talk about crafting sound bites. And if everything goes smoothly with my technology, we're actually going to watch 3 different examples of TV interviews of people giving what I think are good sound bites, and hopefully even discuss those a little bit. And then I'll give my tips for how to conduct an effective media interview. So media lay of the land, this is probably no surprise to anybody on this call, but this is the basic breakdown of some of the top media outlets out there. In Maine, I know that I think the majority of people in Maine continue to get their news from local TV. So in Maine, TV is really #1. And so that's something I think about, when we're trying to get media attention in Maine for things like the community events that we put on and the community forums. TV is always my #1 priority when I'm reaching out to reporters, because that I think is where we're going to hit the most people. Obviously, newspapers, both online and in print. And then the one I want to really emphasize for this audience is opinion media. I think as health professionals, you have a really great opportunity to use the opinion sections of your local newspapers to get your voice out there. This is helpful because you control the entire message. You write the thing. So this is letters to the editor. It's op-eds. Again, you control the message. And fun fact about opinion sections is that they're actually one of the most widely read parts of a newspaper behind the front page. The other important thing about it is that people who are making the decisions about public health policy read the opinion sections of their newspaper. So elected officials, they are reading what their constituents are saying in those opinion sections. One example of this is I co-authored an op-ed with a doctor in Ohio one time. And the doctor reached out to me and said, hey, I just got a handwritten note from our senator, our United States senator, thanking me for that op-ed. So again, they read the opinion sections of their newspapers. So just really quick on things to consider if you're trying to get media attention. We're not going to spend much time on this, but it's a 24-hour news cycle. If you've got news to share, share it, no matter what the time of day. Obviously, there's better times to pitch stories. I typically pitch stories in the morning, but if you have news to share, share it. It's a 24-hour news cycle. There are differences in the kinds of coverage that you're going to get. So there could be like quick hit stories that are just a 30-second TV clip about what you're trying to discuss. There could be really long, in-depth newspaper stories that take a ton of background and work with a reporter. So just different types of coverage. And again, if you're trying to get media attention, you have to know your strategy. And that really comes down to what's the audience you want to reach? What's the outlet that's going to best reach that audience? And then do you want that to be widespread coverage or tailored to a specific audience? And, you know, obviously a TV station, local TV is going to be a much wider audience versus something like Stat News, which people might know on this call. It's the Boston Globe's health newspaper, mostly read by people like us. So that's the difference in widespread versus tailored. And then you want to make it newsworthy. So there's two quick ways to do this. You either create news. So think of this as like, I'm going to write a report with new data that I'm going to share with the media. That's news. Or you fit your story into the news that's already happening. So our groups held a back to school forum at the end of July. That was fitting something into what was already in the news, right? Everybody was already talking about getting back to school and COVID. The CDC had just come out with their guidance on mask wearing in schools. And so we kind of fit it right in there and got tons of media attention across the state for it. Okay, now the good stuff. And I apologize for all the photos of me. Again, this is all mostly based on just my experiences because that's what I know best to share. Being an effective spokesperson, some tips. Number one, know your message. So before you do the interview, know the message that you want to share with that reporter and with their audience. Know the audience, right? So again, different outlets have different audiences. That could be different geographic audiences. It could be different kinds of people. You know, people who watch TV are probably different than someone who actively reads like the Portland Press Herald. So just keep that in mind. And prep before the interview. That includes practicing your sound bites, which we'll talk about in a sec, knowing your message inside and out, anticipating the kinds of questions the reporter is going to ask you, and obviously prepping responses for those questions that will still stick to your message. Sharing credible information is probably one of the most important things for this audience, right? We're out there to share credible info. And then don't get caught in traps. So a quick example of my experience is this photo right here. So I was on MSNBC last summer. We were talking about a health professionals letter we organized calling for stay-at-home orders nationally, because that was when we had that big first summer surge. And the anchor, it was a live TV segment, like 5 minutes long, and the anchor asked me about this Supreme Court case on churches. And it was about whether or not we should allow church gatherings during COVID. This was something I did not want to answer directly because we didn't have a position as an organization on whether we wanted to weigh in on church gatherings specifically. And I just didn't know enough about the court case. So I didn't get caught in that trap. What I said to the reporter when he asked me what I thought about the court case was just, really all I can say about that is I know that when people are in an enclosed space for long periods of time, there's a risk that they're going to contract COVID. And that's all I said. So we'll talk about this in a sec. Answer the question you want to answer and stick to your message. And then keep it short, sweet, and simple. Honing your message. So this, again, is the most important takeaway for your audience. So think when you're about to do a media interview, what do I want the people watching this TV story, listening to this radio piece, reading this article, what do I want them to come away with? That's your message, and you want it to be clear and relatable. So I make sure I put myself in their shoes. Like whenever I'm doing a media appearance, I think about my mom. She's a smart person, but she doesn't work on health issues. She's a retired math teacher. And so I think to myself, are the things I'm saying, if I pop on the TV when my mom's watching TV, will it immediately resonate with her? Will it create some kind of emotional response? Will she immediately understand it? And that's the thing you have to do with the media is put yourself in the shoes of the audience that you're trying to reach. And then again, once you've gotten your message, stay on it. So two ways to do this that are pretty common. One's called the bridge. Don't worry too much about the lingo. Basically, this is using the question as an opportunity to then just say what you want to say. So one example that has come up is the vaccine mandates for health professionals. So this has been a common theme in the media. A reporter might ask you, what do you think about the mask mandates? Do you think, or sorry, not mask mandates, but I guess for that too, what do you think about the vaccine mandates for health professionals? Is that really fair? That's like a thorny question that you might not necessarily want to answer, but you do want to comment on it. And so the bridge, you could answer by doing something like, I think the important thing for people to know is that more than 95% of physicians got the vaccine as soon as it was available to them. And that's your answer. The other way to do it is the pivot. So same question, what do you think about the vaccine mandates? Is that fair for health professionals? The pivot is, I can't say much about the vaccine mandate, but what I can say is that more than 95% of physicians got that vaccine as soon as it was available to them. So that's another way of answering the question you want to answer without getting caught in some of those traps. And you're sticking to your message, right? Which is more than 95% of physicians got that vaccine as soon as it was available to them, which clearly shows health professionals are on board with the vaccine. So sound bites. Key things to know: short declarative sentences make the best sound bites. So keep it short. You might do a 5-minute long taped interview with a TV reporter. They're going to take 10 seconds of that interview, right? That's just how it goes. And so you want to try to do your best to make sure that any of the 10-second clips they're going to take from what you say will be a perfect soundbite. It's really hard to do. I still really struggle with this. Like I prep, but you want to do your best to try to make sure anything you're saying won't be taken out of context and can just fit into a perfect little soundbite. Because again, 5-minute long interview, they're going to take 10 seconds of it. You want to convey your emotion in the soundbite. So this is the thing you want people to come away with, right? Like you want to create an emotional response. This is your chance to really put some oomph behind it. And then when I say signpost, what I mean by that is you want to signal to the reporters and to the audience what your key message is going to be. So this is things like the bottom line is, or you can even say the message that I want people to come away with is. So signal to the reporter, this is the thing, right? This is the thing I want you to take. And to the audience, this is the thing I want you to listen to. Okay, this is the fun part. So we're going to watch some examples of sound bites if the technology works. So bear with me for a sec because I have to use the internet here. There might be an ad. There's going to be an ad. I'll put it on mute while that loads. So I'm going to show a few different clips. I'll just explain this one. This is from a clip that we had promoting our Back to School Forum back in July. And so the reporter talked to Dr. Laura Blasdell from the Maine Academy of Pediatrics here in the state. And Dr. Blasdell is a pro at talking to the media, and I thought she had a really solid soundbite. So we're going to listen to that.
First used last year.
Can everybody hear that?
Children have shown themselves to be incredibly resilient and 100% capable of using those interventions. And in fact, I think children really would just prefer to be together in any way that they need to be. Kids especially.
Okay, so I actually want to hear people's reactions to that. What stuck out to you about that soundbite that she shared?
You can put that in the chat because I have everyone on mute, Matt.
Oh, gotcha. Okay. I don't know if I can see the chat while I'm sharing my screen. Oh, I can. Here we go. Yeah. What resonated to you about that soundbite? Like, what do you think was the key message?
Her smile, children being together.
Yeah. Children being
Resilience.
together, resilience. Yeah. So really what I took away from that was kids want to be in school. We should get them into school and they can make it happen, right? Kids are resilient. They can handle wearing masks. They want to be together and we can do it. And definitely the smile. So we're not going to go too much into like the body cues, but yeah, that was great. Smile, slow, cadence, not too fast. Again, she's a pro. Okay, we're going to watch one of my sound bites. And this is an example where this TV interview was 5 minutes long, and you'll see how much of the thing they actually ended up taking. I'll put it on you for a sec. Okay, so I am
Day calling for another national closure.
We need to stop taking these kinds of half actions. We need bold action now to save lives. Otherwise, we're just going to keep going through this cycle over and over again.
Listen.
How about that? What do you think was my main message there? Any words that stuck out to you?
Tough action, bold action.
Yeah.
Bold action now to save lives. Action. A lot of action.
Action, people, action. Yes, thank you, Becca. Yeah, I mean, totally, Maureen, action, sense of urgency. I mean, this was the first summer surge, right? People were dying and governors were sitting on their hands. And so we were calling for bold action, not half measures, bold actions, for sure. Okay, and then we're gonna watch the last clip if we have time. Do I have like 2 more minutes, Becca? Okay. Of course, got to show Dr. Narob Shaw's clip here. So this is from just like 4 days ago, and he does a great job of
what's important here at Moody's.
He does a great job of being really clear, sharing clear information, but he, I think, is also a pro at understanding what it's like to talk to the media and getting his punchy sound bites out there. So let's see what Dr. Shaw does here. Okay.
EC director wants to
Boosters are not a medical emergency.
Oh, sorry, I want to go a little further back. Here we go.
yet.
Boosters are not a medical emergency. They are important, but they are not the pathway out of the pandemic at this point. Whether vaccines remain effective is a resounding yes. Boosters, based on the data that we've seen so far, are more in the category of like the flu shot, something you should do as we get into that season.
Okay.
Meanwhile, Maine's CDC.
So what I took away from that really quick is, number one, boosters are not the pathway out of this pandemic. And then number two, he's reemphasizing the message that he wants to emphasize. Vaccines are effective. Vaccines are effective, right? The important thing for people to do is get vaccinated now if they haven't been vaccinated. Boosters are not the pathway out of this yet. They're going to be important, but it's not the thing we should be really focusing on at this point, for everybody at least. Awesome. Okay, I won't share that one. So my interview tips, this is my last one here. Again, prep beforehand, make sure that you have a sense inside and out of the kinds of questions you think the reporter is going to ask you. Prep responses to those. Think about like, what are the potential traps I'm going to want to avoid, not answer, stay on message. Answer the question you want to answer. Again, we talked about those tips for staying on your message earlier. So that bridge and the pivot, using signposts to emphasize your message. Always take the opportunity to reiterate your main point. So what reporters will often do is at the end of the interviews, they'll say, is there anything else you want to share? Totally take that opportunity to just restate your message. So what I often do is I'll say, to sum it up, X, Y, and Z. And more often than not, that's the quote that they take, because they know like that's the key message that you're getting out there. So always take that opportunity. Don't walk away from it. Take that opportunity to restate your message. Keep it short and sweet. And then one just good logistical thing to know, everything is on the record. Unless you tell reporters specifically that you want to be off the record and you get an agreement from them, you should consider everything you say to be on the record, and that they might print it or put it on the radio or TV. Again, unless you specifically say, can this be off the record? I want to share some background with you. And if they agree to that, then that's fine. But just keep that in mind too. And that's all I've got.
Great. Thank you, Matt. So if you have questions for Matt, please feel free to put them in the chat. And now we're going to turn it over to our second presenter for today. I'm excited to introduce Todd Phillips, who is the infection prevention nurse at Millinocket Regional Hospital. And Todd will be presenting about effective strategies for responding to misinformation in a one-on-one or small group type setting. So Todd, with that, I'll turn it over to you.
Thanks. Excuse me. Thanks, Becca. Yeah, actually, to build up on what Matt said, here at the hospital, we actually have a select group of trusted media partners. Talk about sound bites and stuff. You'll find that you'll make that mistake only once. Well, you'll say something that it was taken out of context, or you sounded stupid or whatever. You'll make the mistake once, and from then on, you will speak in sound bites. So I do encourage everyone to find who those trusted media partners are within their organization. Yeah, that's just a tag on to what Matt was saying. So Hi guys, I'm Todd Phillips. I'm a nurse with a background in Masters of Public Health, working here at Millinocket Regional Hospital. And I got invited to the forum based solely, I think, on the success of what we've been able to do up here in rural Maine. We here at Millinocket, even before the mandate, had a 96% vaccination rate within our hospital. We obviously are at 100% right now. Millinocket town itself has an over a mid 80s, I'd say 84 to 85% vaccination rate, as do our schools. We've been good. We've been very successful. And part of that had to do with what I'm going to be here talking to you today about, and that's misinformation or disinformation, which is, there is a difference between the two. And unlike Matt, I don't have any fancy slides, so you guys are just going to have to put up with me for a few minutes. So the difference between misinformation and disinformation, disinformation is intentionally meant to mislead you. It's meant to take you to a complete other direction. Misinformation just could be, just like it sounds, they just misunderstood. They didn't quite know what they were talking about, or they took a little soundbite here and a soundbite there to piece it all together, and suddenly they have an opinion about it. When tackling a lot of these issues within your own organizations, everybody's going to have a reason to either not get the vaccination or they don't want it. And a lot of it really comes from they just don't understand. Someone never really had a chance to sit and talk with them. They didn't really have anybody to really talk to. And within your own organization, despite its size, you've got to find somebody within that organization to do that work. Our success here, I was placed in this job on November 2nd of the fall of last year, November 2nd of 2020. And I had 1 month to get my ducks in a row and get all my people like pretty much on the same page. And all of that came from is preparation. And so let's talk about there are 4 points in regards to battling misinformation. Preparation is one of them. Part of the misinformation campaign that's out there is being funneled through social media. You have to know what's out there. You don't have to troll all the sites. You don't have to really, but you have to research what people are talking about. Within your own organization. Say, for example, you have someone who is hesitant about the vaccine itself. Ask them where they're getting their information from. Hey, share with me some of that information. And with that, you can research and delve in a little bit deeper as to where they're getting their information from, who they're getting it from. Is it a trusted source? Is it a media source? And with that, you'll get a better appreciation of, is there a hidden agenda inside of this misinformation or disinformation? A perfect example of one of my colleagues, I asked them what, for a copy of their source. They gave me a stack of papers, nice and big. I looked through it all. Some of it I recognized, and some of it I did not. Some university studies, quote unquote, university studies, I looked at them and they were consistent and equal to the person's personal belief system. It was a religious right-wing university, known for its very conservative ethics, which is fair and exceptional. I'm glad this person had an opinion, but does this opinion from this source change what they believe to be their opinion already? I'm notorious for saying that the internet is full of research that will already support what you already believe. And what your goal needs to be when going out there is not to convince people one way or the other, but at least be able to speak to where they're getting their information from and what that message is. That's part of the research process. You kind of have to have all those little tricks in your bag and be able to pull out going, oh, I've heard that one before, or yes, I've seen that before. And being able to kind of, like Matt was mentioning, stay on your topic. You are leading this conversation. So the first portion of a 4-point system is to prepare. Do your hard work, do your homework. The second point is listening. And as difficult as that may be when you're faced with some of this misinformation, I think some of the words like "you have got to be kidding me" have rolled around in my head from time to time. Just don't say it out loud. That's judgment, and people don't like judgment. But in the portion of listening, you have to make sure that the person is engaging with some sort of false platform. Most often, they're getting a snippet of truth with a lot of BS from one source, and they're using that as rule, as law. When listening to them, you have to see where they're getting their information from. Like, I saw it on Facebook. That's one of my least favorite 5 words. Or I saw it on the news, my second least favorite 5 words. Because a lot of times people in working with Soundbites, they just want to get a reaction from you. And so when people are getting their information from these Soundbites and not from quality sources, they're going to have a skewed sense of opinion. Your job is to stand there or sit there, look them directly in the eye and listen to them without judgment. One of my biggest successes is that I tell people, once again, I'm not here to convince you one way or the other. Someone once told me that dandelion tea works for COVID. And I looked them right in the face. I said, I respect your opinion. I just don't agree with you. And that is what will really put you on a level playing field with that person to have that conversation. Because people nowadays are so polarized, they're used to always having a sense of conflict in a conversation. And if you can minimize that conflict by giving them the respect that they deserve through listening to what they're saying, it's going to go a long way. That initial conversation may not bear any fruit, but I will guarantee you that if you stay consistent in your message, in your listening, they will come back to you when they're ready or when they have more questions. Point number 3 is just to understand that not all rumors are false. When people are looking at, once again, social media or whatever news outlet they're getting things from, there's always a grain of truth in misinformation. That's what brings people in. That's what makes bad information sticky. That's what makes it stick in people's minds. So just be aware that just because you may think it's false, they believe it to be true. There is a grain of truth in just about everything. Kind of get an appreciation or assess what your impact on this person is going to be before you open your mouth. Are they coming to you just to let you be the sounding board? Are they coming to you because they want genuine good information? Where is this person in their learning process, and how can you really help them understand how to move forward in battling this misinformation? One thing I like about my master's program is they really spoke a lot about situational awareness. You have to, when you're looking for someone to have a conversation with, or they're looking for you to have a conversation, ask yourself, who created this source of information? What sort of, when was it created? What's the date on it? Is it relevant? Does the person who created the source of information have a hidden agenda? And a lot of times you'll find that they do. Either whether it be a conservative, liberal, it's not politics. It's just that people will find that they have an agenda in what their message is going to be. Once again, as the healthcare providers in the field, you set the agenda by staying true to your message, what you're trying to accomplish and get from this person. And then last but not least, my 4th point is when you do choose to engage, once again, and I reinforce this just as Matt did, you shape the agenda, you shape the conversation. So if for your interactions with this person, if you became judgmental or you were kind of tuned out or didn't look the person in the eye, that body language goes a long way to engaging this person in genuine conversation. There's a term called prebunking. You've heard of debunking a rumor. Try to pre-bunk it with your knowledge, saying, I have heard that this rumor going around about some microchip in someone's arm. Do you know how hard it is to put a microchip in a 25 gauge needle? Clinicians who have had experience with a 25 gauge needle know it's going to be pretty darn difficult. But if you attempt to preempt their rumors or preempt some of their knowledge with fact, it has a lot of times a tendency to kind of bring them back to the conversation, or at least continue to allow you to engage in the conversation. Try to teach people, if you have a moment, how to look beyond the content that they're looking at. Try to make sure that give them better sources of information. Perfect example is my neighbor was looking to get some more information about COVID. They were scared, and justifiably so. I get it. But I said, well, where are you getting your information? They said, well, Facebook. I said, well, you need to get off of Facebook and let me give you this, and this. And I give them different resources as well. Our success here at Millinocket Regional Hospital started with that. I put out a survey monkey to all my staff that said, hey, how do you want your information? Do you want it in scholarly journals? Who do you get your information from? And that was a brief 8-question survey monkey. really was the foundation for my communication with my entire staff from November 2nd on. And that was, I gave them what they were looking for in the format and the media or whatever that they trusted, that they asked for. So if someone asks you a simple question and you give them a complicated answer, I guarantee you they will tune out after 5 words. So try to keep it concise. And also, if you have the opportunity to debunk someone's misinformation, do it respectfully, do it in a positive manner, give them a source, once again, that backs up your information. That was really probably one of my biggest challenges as well, because people don't want to change their minds a lot of times. Many people are going to be on the fence about this, and they may not want to hear what you have to say, but if your message is consistent, it is accurate, you are always on top of what the latest, greatest rumor trends out there are, that will really go a long way. I mean, I personally, and it doesn't take a lot of time. I know most of you are sitting out there going, geez, Todd, I don't have time for this. 15 minutes out of your day while you're drinking your coffee, scroll through whatever, or talk to a conspiracy friend, because everybody's got a conspiracy friend, and see where they're getting their information from. For the record, I will point one out to all of you. The Fort Fairfield Journal out of Fort Fairfield, Maine, is an excellent source of disinformation. I call it my personal tabloid. And it's a great place for me to see where the trends of misinformation and disinformation are coming from. And I look at the sources that they cite, I look at where they get their information from, and I go through those 4 steps that I mentioned before and prepare myself for discussing this with people. So once again, my 4 points are: prepare through research, listen to what the person has to say and where they're getting their information from, understand that all disinformation and all rumors have some truth to it. So try to understand where they're coming from. And when you do engage them, continue to stay on message. And that is the message that you create. This blends very nicely with what Matt had to say in regards to speak in sound bites, speak in short, clear, concise sentences, so that everyone can really be on the same page, and do it consistently. Don't be afraid to put emotion in it. Some of you may have heard the NPR story that was done on our region. And like Matt said, I had a beautiful 25-minute interview with a trusted source, and my interaction was literally less than 30 seconds. And the first words out of my mouth in that article was, I cried. And I did, but I spoke my truth with my emotion. And as people know, I'm not afraid to shed emotions towards this crisis. So I was never embarrassed by my words, because my words reflected my truth and the effort that it takes to do what we do here. And if each of you do consistently the same thing, you'll find that your success rate, especially, and your respectability rate within your own organizations will increase tenfold. So thank you, Becca. Appreciate it. Thanks for everyone. I'll take questions anytime you want.
Yeah, thank you, Todd. A couple have come in, and if folks have other ones, please put them in the chat. The first question is, do you need to quarantine after exposure if you are fully vaccinated?
In theory, no. In theory, if you've been exposed and you're fully vaccinated, as long as you're wearing a mask, you can and you're asymptomatic, you can continue to do what you normally do. But a lot of this is really based on your own internal policies. Once again, finding out where people are getting their information from, the Department of Education has a completely different set of parameters for their teachers and students. So in my work, I have to make sure that I understand the DOE's recommendations and procedures. But for our hospital, as long as you are asymptomatic, as long as you continue to wear a mask, which is mandated here anyway, if I can live without you for 10 days, I'll put you out, because I don't want any risk in my facility. But if you're considered a very essential person, a very essential worker, and you can do your work safely, and you can be trusted to continue wearing your mask, et cetera, I'd keep you.
Great, thank you, Todd. The next question is, and I think this could be for either you or Matt, which research or evidence do you use to develop your communications strategies?
Matt, you want to take this?
Yeah, I can take the first stab at it. So for the communications tips that I give and the strategies, that's based off of like 50+ years of our experience communicating with the public about all kinds of issues, public health issues, consumer issues. PIRG has been around since like 1973. So that's just a wealth of experience and, historical knowledge. We also have a communications department. So Mark Morgenstein's our communications director, worked at CNN for 20 years, is steeped in how to communicate with the media. So that's the tips and tactics. For the information and the sources, I think I'd pass that to Todd about like, actually, how are you getting your information about being effective on communicating? Yeah, go for it.
Obviously, you want to make sure that you are getting solid facts. So I go straight to the source, CDC. Those are the guidelines that we're being held accountable for. So that's where I go for my information. Now, those websites are extremely difficult to navigate sometimes. You will get bogged down with too much information. So I go to the BBC World Service out of the UK. I use UNICEF. As some people know, I've lived overseas for 10 years before I made Maine my home. So there are some trusted sources that I will go to that can provide information to me in sound bites, because my time is limited as well. New York Times, Washington Post, the AP. I don't watch local news, not because I don't trust them. It's just that a lot of that is recycled from somebody else, and I want it from the source. For example, my own interview, NPR did the interview, it was very well done, but then the Bangor Daily News picked it up and turned it into sound bites. And as it continues to get diluted down and down, you get less and less information. So I choose New York Times, Washington Journal, Mayo Clinic, also a very good one, CDC, and actually UNICEF is also a very good one, World Health Organization.
Great, thank you both very much. One more question did come in, but Todd, I'm going to give it to you to respond to in your breakout, just so we can move folks into those. So I pre-assigned everybody, just for the sake of efficiency, to a breakout room. You're either in a media communications room with Matt and Megan Hannon from Maine Community Action Partnership, or you're in a breakout with Todd and Maureen Leary, also from MECAP. So for the next about 25 minutes, you'll be in those breakout rooms, and it'll give you a chance to practice what we've been discussing. And to the outstanding question that I have, I will share that with Todd before you go into that breakout room, so you can have your question answered. If for some reason I've assigned you to one that you don't want to be in, or you'd rather practice in the other one, you can leave your breakout and I can put you into the other room. So with that, I'm going to put you in your breakout rooms. I want to thank Todd and Matt again. And then once those are over, we'll regroup just for some closing remarks and let you get on with your day. All right, welcome back. It seemed like I could see some animated conversation, so that was great. It's always so hard to pull you back from breakout rooms, so I'm sorry about having to do that. Thank you for such engaged conversations. I hope that you enjoyed your sessions. And again, I want to thank Maureen and Todd and Megan and Matt for leading those discussions, and for all of you for your participation. Before we close out, I do just want to flag a couple of things. The first is that today's webinar was recorded, and so I'll share that recording with all of you when it's available, which will hopefully be this week, tomorrow probably. We are hosting this same training tomorrow evening at 6 p.m. So please do tell your friends and colleagues about it. And if you need that information, please send me an email, and I'm happy to send you the registration link, mainepha@gmail.com. And I hope you'll save the date for next Thursday, September 30th at 6 o'clock for another webinar that we'll be hosting about talking with family and friends about vaccine misinformation. And we'll be sending out the registration information for that later this week. So I want to thank you all so much again for joining today. I hope to see you again on another future webinar, and I hope you enjoy the rest of your day. So thank you.
Thank you, everyone.